Professor Matusiak, please tell us more about your recent research project. We know it's a brand new idea, shedding light onto molecular underpinnings of neuroplasticity in deafness treatment.
Well, yes, I carried on a research project which aimed to identification of biomarkers of neuroplasticity after cochlear implantation in prolingual cases. The rationale to take up this idea was a huge diversity of cochlear implantation outcome, especially in prolingual cases. And we know that we have star performers, so children who develop speech and language fantastically, almost on pace with their normal hearing peers. But we also have children who are not that successful and who continuously lag behind, despite even the enormous effort of rehabilitation team. So I searched to the basic science, to the molecules, to see if they're in the so-called wetware, it means in the brain, if there we can find any other critical factors for functional outcome of cochlear implantation, because we know that there are some already known factors influencing the outcome of cochlear implantation, like age of implantation, comorbidities, etiology of deafness, family support, and so on. But this is not everything, and we know that there must be some other factors, well, in the brain, which also critically influence the outcome. So I've constructed the study in which I've searched for molecular factors involved in neuroplasticity after cochlear implantation. That is, factors which are involved in memory formation, just because we know that to produce language after deafness treatment, we need a memory. And memory is just a chain of neurons connected by synapses. And the synaptic connections between neurons this is exactly the focus in which the molecules play between pre- and post-synaptic membranes, and this is where I was looking for this another critical factors for the outcome. So that was truly a translational approach to a purely clinical problem.
So I presume you had a group of implanted children.
Yeah, I had a prospective cohort study to which I enrolled over 70 deaf-born children, over almost 3 years. It took me that long just because I've enrolled only children who were otherwise healthy. I mean, I excluded all children with any other comorbidities. And those children were qualified for cochlear implantation. They were implanted, and all of them they were implanted with the same cochlear implant. And all of them became a regular cochlear implant user. So I have tested them for genetic polymorphisms of two proteins, which is matrix metalloproteinase 9, MMP9 in abbreviation, and brain-derived neurotrophic factor, which is well-known molecule, BDNF. And I also measured the plasma levels of those proteins in the blood at the time of the cochlear implantation.
And what are the results?
Well, our results are truly promising, just because I have found out that if at cochlear implantation a child has a low level of MMP9 in plasma, which means low means it's below 150 nanogram per milliliter, this gives almost 100% or at least very high odds, 100% of guarantee that the child will score very high after 18 months of using cochlear implant.
What about children who start rehabilitation with MMP9 higher than 150 nanograms per milliliter?
Well, that's a very, very good question, because we know that these children are at higher risk of failure of speech and language rehabilitation outcome. And what we could do, we would possibly be able to overcome this risk, and we would maybe be able to administer inhibitor of MMP9 activity. And they are currently present on the market, and they are tested in a clinical trial phase 2 as a prevention of post-traumatic epilepsy.
But what does it have in common with deafness treatment?
Well, it has quite a lot in common, just because MMP9, we know that MMP9, if abundant, it can block plasticity, which we need. We need a plasticity for rehabilitation of auditory skills after deafness. And abundant MMP9 can also result in aberrant plasticity, which is sort of a side effect of brain trauma. So we know that after brain trauma there is a very rapid, huge elevation of MMP9, and as a side effect, as I said, they can start epilepsy. So administering inhibitor of MMP9 decreases the activity of MMP9, and it blocks or prevents the post-traumatic epilepsy. So in analogy, if we would have a child with high level of MMP9, deaf child, before cochlear implantation, which we would be able to check at the moment of diagnostics, when the child, like 3, 4, 5 months, come to our center for deafness diagnostic. If we would check what's the level of its MMP9, and if we would know that it's high, that it probably would block its natural plasticity, then if we would be able to inhibit the activity of MMP9, then we would probably be able to move this child into the much higher chances for good outcome of cochlear implantation, to give the child higher chances for successful outcome of rehabilitation speech and language.
Thank you so much for the interview, and once again, congratulations on the occasion of the promotion for associate professorship.
Thank you so much.